Turmeric contains curcumin, an ingredient with medicinal benefits. People use it to help relieve pain, reduce inflammation, and promote healing. The turmeric that we see on shelves and in spice cabinets is made of the ground roots of the plant. The bright yellow color of processed turmeric has inspired many cultures to use it as a dye. Ground turmeric is also a major ingredient in curry powder. Capsules, teas, powders, and extracts are some of the turmeric products available commercially. However, turmeric may also have some adverse effects. So in this video, we are going to discuss avoid turmeric if you have these health problems. But before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. Number 10. Gallbladder problems. Problems with your gallbladder can be painful and frustrating. Understanding how your body works can help you find the best way to overcome this and lead a more fulfilling and healthy life. Your liver is the largest and one of the most important organs inside your body. It is responsible for converting food to energy, cleaning toxins from your blood, and producing bile, a liquid that aids digestion. It is important to remember turmeric also aids in digestion and minor digestive disturbances and promotes general well-being. Along with relieving symptoms of bloating, gas, and flatulence, turmeric supports a normal, healthy immune system. Turmeric can make gallbladder problems worse. Do not use turmeric if you have gallstones or a bile duct obstruction. Turmeric can worsen gallbladder problems because of its ability to increase bile secretion. People should avoid using turmeric supplements if they have gallstones or bile duct obstruction. Number 9. Surgery. High doses of turmeric and curcumin are not recommended long-term since research confirming their safety is lacking. However, the World Health Organization (WHO) has determined 1.4 milligrams per pound, 0 to 3 mg per kilogram, of body weight an acceptable daily intake. Turmeric might slow blood clotting. It might cause extra bleeding during and after surgery. Stop using turmeric at least 2 weeks before a scheduled surgery because of the risk of bleeding during and after surgery. Turmeric results in delaying the formation of blood clots. Number 8. Breastfeeding. Turmeric is commonly used in small amounts as a spice in foods, as turmeric may increase the risk of bleeding in patients taking warfarin and antiplatelet drugs. Because of a lack of data, turmeric in amounts higher than those found in foods as a flavoring should probably be avoided during breastfeeding. But there isn't enough reliable information to know if turmeric is safe to use in medicinal amounts during breastfeeding. Stay on the safe side and avoid use. Turmeric may lower blood sugar levels. When combined with medications for diabetes, turmeric could cause hypoglycemia, low blood sugar. Although it is safe to eat foods with turmeric, pregnant and breastfeeding women should not take turmeric supplements. Number 7. Bleeding problems. Taking turmeric might slow blood clotting. This might increase the risk of bruising and bleeding in people with bleeding disorders. Turmeric's purifying properties may also make you bleed more easily. It's not clear why this happens. Other suggested benefits of turmeric, such as lowered cholesterol and lowered blood pressure, probably have something to do with the way turmeric functions in your blood. People who take blood-thinning drugs like warfarin, Coumadin, should avoid consuming large doses of turmeric. Turmeric slows blood clotting, leading to an increased risk of bruising and bleeding in people with bleeding disorders. This is especially important in those who take injectable blood thinners. Number 6. Upset stomach. As we all know, turmeric or haldi is said to produce heat and warm the body. In case you have too much turmeric, you might end up with severe inflammation in your stomach, which can cause diarrhea. Some people also experience abdominal pain and cramps. The same agents in turmeric that support digestive health can cause irritation when taken in large amounts. Some participants in studies looking at the use of turmeric for cancer treatment had to drop out because their digestion was so negatively affected. Turmeric stimulates the stomach to produce more gastric acid. While this helps some people's digestion, it can really do a number on others. Number 5. Pregnancy. Turmeric is commonly used in small amounts as a spice in foods, but it's likely unsafe to use larger amounts of turmeric as a medicine during pregnancy. It might cause a menstrual period or stimulate the uterus, putting the pregnancy at risk. Do not take medicinal amounts of turmeric if you are pregnant. You may have heard that eating foods seasoned with curry can stimulate labor. Although there's little clinical data to back up this claim, studies suggest turmeric can ease symptoms of PMS. So there may be something to the old wives' tale. Because of its blood-thinning effects alone, pregnant women should avoid taking turmeric supplements. Adding small amounts of turmeric as a spice to food shouldn't be a problem. Number 4. Increases risk of developing kidney stones. One of the most important things to remember about this beneficial spice is that it increases urinary oxalate levels. Turmeric also contains oxalates that could increase the risk of getting kidney stones. That's because oxalates bind with calcium to form insoluble calcium oxalate, which is a big reason why kidney stones occur. So ladies, do not overconsume this spice to avoid any sort of kidney damage. Curcumin is high in soluble oxalates. These oxalates attach themselves to calcium and create insoluble calcium oxalate, which is responsible for most kidney stones. Around 75% of all kidney stones are calcium oxalate. Remember that you don't need to consume large doses of turmeric to face the risk of kidney stones. Supplemental doses can significantly affect urinary oxalate levels and boost the risk of developing kidney stones in susceptible people. Even when consumed in small doses, turmeric can also cause mild side effects despite being classified as generally recognized as safe by the U.S. Food and Drug Administration. Number 3. Infertility. Turmeric might lower testosterone levels and decrease sperm movement. This might reduce fertility. Turmeric should be used cautiously by people trying to have a baby. Turmeric may cause infertility in men by lowering their testosterone levels, decreasing sperm movement. Hence, men trying to have a baby should use turmeric cautiously. Recently, we have found that the active ingredient curcumin in turmeric could be adverse for fertility. Curcumin reduces the growth of the cells in the lining of the uterus, endometrial cells. This is why it can be useful during treatment of endometriosis if you're not trying to conceive. If you are trying to conceive, curcumin may be associated with thinning of the lining of the uterus wall and may therefore reduce embryo implantation. If you are undertaking an IVF cycle, avoiding curcumin may be wise. Large amounts of turmeric might interfere with the effects of estrogen. Taking turmeric along with estrogen might decrease the effects of estrogens. Some estrogen pills include conjugated equine estrogens, Premarin, ethinylestradiol, estradiol, and others. This suggests that turmeric can stimulate ovarian functions not only by promoting the release of leptin, but also by modulating the response of ovaries to LH. We suggest that dietary turmeric may affect ovarian LH receptors, with lower doses being more effective than higher doses. Number 2. Liver disease. The consumption of turmeric in daily life is getting a lot of attention because of its antioxidant capacity. The antioxidant effects of turmeric seem to be so powerful that it can prevent your liver from damage caused by toxins. This is especially beneficial for people who are taking certain powerful medications for diabetes or other health conditions that can damage the liver with long-term use, but there is some concern that turmeric can damage the liver, especially in people who have swelling, inflammation of the liver, hepatitis, or reduced or blocked flow of bile from the liver, cholestasis. Don't use turmeric if you have these liver problems. Liver injury due to turmeric appears to be increasing in the United States, perhaps reflecting usage patterns or increased combination with black pepper. Turmeric causes potentially severe liver injury that is typically hepatocellular with a latency of 1 to 4 months and strong linkage to HLA-B*35:1. Number 1. Allergic reactions. Turmeric is the dried rhizome of curcumin along the lane, which is extensively used in Indian culture. Curcumin is its most active pharmaceutical component. Turmeric use is very closely related with the socio-religious life of the population. Topical application of turmeric is a very common practice in the daily lives and auspicious occasions in South India. However, the allergenic potential of this commonly used spice is mentioned in various case reports and studies. The dermatologists and patients should be aware of the possible allergic reactions of this widely used herb. Curcumin can cause contact allergy, and some people have reported contact dermatitis and urticaria hives due to skin contact with turmeric. As turmeric is part of the same family as ginger, you're more likely to have a reaction if you're allergic to ginger. If you are allergic to yellow food coloring, you may also be allergic to turmeric. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we will be back soon with another video.